Welcome. Today we're going to talk about something very important called the facet joints. Another name is apophyseal joints, zygapophyseal joints. These are the joints where each vertebrae has two pairs, two above and two below, and they are designed to allow the vertebrae in the cervical spine, with the exception of the atlas, the first vertebrae, to sit on each other. And there are synovial fluids within the joint. There's cartilage around the facet joint that allows that joint to be encapsulated. So in other words, when we bend the head forward and backwards, or left, right and left, or left and right, these joints is where all the movement is. But what happens is through poor postural weight bearing of forward rounded shoulders, incorrect positioning of our head over time, doing things incorrectly, this can cause excessive changes within the soft tissue, primarily the fascia that surrounds these joints, that can start to develop this fasciitis or this scar tissue or adhesions that start to develop around this area. This will bring us limitation of range of motion to the left and to the right. You may notice when you drive, you're turning your body to look back. You may notice that when you're looking over, you're kind of looking over with your body. You may notice that you've lost a lot of range of motion. You may be experiencing headaches, neck pain, radiation, radiculopathy into the chest, mid-back, down the arms, into the hand, tingling, numbness, whatever it may be. And you might even have been diagnosed having a bulging or a herniated disc, but it might not even be attributed to that disc problem. Strictly from around these facet joints, these apophyseal joints, as a result of fibrotic scar tissue, which is causing irritation on the nerve root. Remember, this particular facet joints that we're talking about, the nerve roots are right actually in front of them. If you look at the facet joints here, you can see how they open and they close. These are where all the weight bearing of the head is coming down on each vertebrae. So as these vertebrae degenerate, they're degenerating because it's holding up excessive more force or more weight bearing or more stress than it normally does, which leads to this particular ailment. So the purpose of this technique is to restore movement into these facet joints. That if there is adhesions, we're limiting range of motion, causing more degeneration in the future and causing inflammation on the nerve root. Those nerves that come out between the vertebrae is what's causing potentially your problem right now. So as we're going to rotate our head into a certain position, we're going to help increase more rotation to free it up, to reduce irritation off the nerve and increase function. We're going to use a towel, and I'll show you after as well. We can use a TheraBand right here. But let's go show you with the towel, because most of you have towels, and this can be done any place, anywhere. Take it around the neck. Now, what I want you to do, we're going to do two different levels. And let me show you. The first level we're going to do, we're going to work primarily between the second and the fourth vertebrae. Okay? So it's going to be here to about here in the upper level. And then after, we're going to work a little lower in the lower level of the neck. Remember, there's 7 cervical vertebrae. So let's take the towel and put it below the head, not right below, but a little bit kind of in the upper neck area. Okay, I'll turn around like this. You can have an idea where I'm located here. Okay, and what we're going to do, we're going to rotate our head to the left. And while rotating our head to the left, we're going to take our right hand, we're just going to pull forward as we're going to actually look a little bit more to the left. And you're going to feel more stretching on one side. And you'll hold it there about 20 seconds. And then you'll go ahead, you'll turn your head to the right. And as you turn to the right, you're going to take your left hand, and as you turn more to the right, you're going to pull that left hand forward as we stretch more. And you may feel a little burning in there, and that's just the soft tissue pulling in that area, which is what you want. You're going to do that about 20-25 seconds. Good, and you'll hold it there. You'll come a little bit lower down now, okay? And we'll do the same thing. We'll turn left, and as we turn left, we're going to take just the right hand, pull it forward. Go ahead and pull, and you'll really feel a burn on that, those muscles around those facet joints. And you'll hold it there about 20-25 seconds, okay? And you're gonna hold that there, and you'll just keep pulling forward, and then you'll go ahead and you'll turn your head to the other way, the right side, take the left hand, pull forward, and then you'll feel the stretching on the other side, about 20-25 seconds. This can be done once or twice a day. Now, you can also use a thicker band if you have, this is a TheraBand where you can take it like this and you can turn and pull on one side and it kind of sticks a little better to the skin. And you can go the other way and pull the other side. You can go a little bit lower too. There are other things you can use if you have a thick rubber rope or anything that's kind of dense and thick. But again, the towel should work. And the reason why I would recommend the towel is because everyone has a towel. So I hope this technique makes a big difference. I really think you're going to get great results because this is a very, very common problem. Many doctors will miss it because they're just looking for the pathology from the MRI, the CAT scan, or the X-ray. They're not looking at the biomechanics. Everything is all about movement. When you lose movement, you will increase degeneration and degenerative problems in the future, and that's something you cannot afford. I ask you to share this video, subscribe, and most important, make it a great day. I'm Dr. Alan Mandell.